Now, I want to talk about the factors of sexually transmitted infections. Now, when you talk about factors, it's more of like you're trying to talk about what are the things contributing to make it that this disease condition is being spread so fast. Okay, so for sexually transmitted diseases, its spread are influenced by a combination of how the person behaves, the biological factors, the social factors. Okay, so the most significant risks include if you have been having unprotected sex, if you have been having sex with so many people, if you started having sex so early on in life. So let's talk about them in depth. Unprotected sex, like you're not using condoms, you know, multiple sexual partners. Of course, the more partners you have, the more you can control them. If you just have sex with new people or people you don't know about their behavior. So substance use, if you take alcohol or drug, it can impair your judgment and it can make you behave anyhow, having sex randomly. If you're a sex worker or you're somebody that actually have sex to get money, okay, you can be at risk. So biological risk factors is age. Young people are the mostly affected. Women are more vulnerable to STDs because of their anatomy. Then if you have one sexually transmitted disease, it now actually predisposes you to having the next one. Okay, so social and structural risk factors is lack of access to healthcare. So sometimes you have these STDs but you can't really access care. Okay, stigma or discrimination, poverty or low education levels, cultural and gender norms. So in some cultures, norms may discourage condom use, okay, or discourage women from not being reached. You understand?